When was the last time you grabbed a bottle and could not let go? Now, I'm not talking about your Friday night situation at the bar, but I'm talking about compulsively grabbing an object and having issues releasing it. For many of you, the answer would be never. But for a 60-year-old Tesa, it is an everyday issue. She suffers from what is known as alien hand syndrome. Alien hand syndrome is an umbrella term used to describe a series of conditions where the limbs act seemingly of its own accord. This manifests with the alien hand moving on its own, grabbing objects or interfering with the other hand, like with 75-year-old Agnes, whose alien hand contradicts the function of her healthy hand. Different variants have been observed as the result of damage to different brain regions. Let us have a look at Tesa, a 60-year-old woman with lesions in her dominant medial frontal cortex. Often patients suffering with this variation of AHS have affected supplementary motor areas. This is involved in inhibition of unwanted movements, and because of this damage, the patient experiences compulsive manipulation of tools, groping and grasping, and also issues with releasing objects. Most patients experience this behavior with their dominant hand, and in the case of Tesa, it is in the right hand. 75-year-old Agnes presents with the prototypic case of callosal AHS. This subtype of the syndrome is a result of damage to the corpus callosum, a structure of the brain which facilitates communication between the left and the right hemisphere. In this case, split brain surgery was the cause of damage. Notice how every time Agnes attempts to turn over the page with her right hand, her left alien hand keeps closing the book. Despite appearing purposeful and coordinated, Agnes insists that the actions of her left hand are unexpected, unintentional, and unwanted. This is called diagnostic dyspraxia. This is when the non-dominant hand involuntarily conflicts with the voluntary actions performed by the dominant hand. 66-year-old Daniel suffers from a variant of AHS, which is a result of damage to the parietal lobe. This region processes somatosensory information and plays a significant role in bodily awareness. Last year, Daniel suffered a stroke, which resulted in a lesion in his right parietal lobe. This has left him unable to feel tactile sensations in his left arm, which he calls lefty. He suffers from estrangement. This is a psychological state where he doesn't believe the arm belongs to him. If he is not paying attention, for example while walking or chatting with a friend, he experiences involuntary levitation of his affected arm, which he must manually restrain. Medications such as botulinum toxin, more commonly known as Botox, and neuromuscular blocking agents have shown prominence in treating AHS. Cognitive and motor therapies such as mirror box therapy and visual coaching also showed success in managing alien hand syndrome. These treatment methods are patient-tailored and not universal.